and that's what we're looking for the diagnosis of autism. And so I think there's that and a lot of denial, especially with certain cultures, right? They don't, that's not something that's considered, or it's considered a bad thing. I mean, I've encountered parents where when I tell them the diagnosis for their child, now they say, well, we're going to lose our family and our friends. And this is in the US. And I'm like, oh, so how can we walk through that?
Hello, and welcome to Disruptors at Work, an integrated care podcast. Today, we're examining why autism-informed care is not a specialty, but the ethical standard for every treatment plan.
Hello, and welcome to Disruptors at Work, an integrative care podcast. I'm Nicole Heuer, and special host for today's episode. Today, we're examining the reality that healthcare often overlooks, that failing to account for autism in treatment planning leads to poorer outcomes at every care level. Autism affects each touch point in the care experience, from communication and sensory processing to symptom expression, medication response, and trust in providers. When healthcare systems overlook the neurobiological realities, care pathways break down and outcomes decline. To help guide this discussion today, I'm joined by two incredible leaders in integrative care, Dr. Ronke Komolafe, DBH and MBA founder and CEO, Advancing Integrated Health, and faculty here at CGI, and Dr. Hokehe Eko, who's the pediatrician and CEO of Glow Pediatrics, specializing in autism and ADHD-informed care. Starting the conversation, guys, I kind of just wanted to open up to what your experience is with autism and providing care to patients, and how you've seen either positively impacts by providers who have the experience or negative by impacts who did not inform their care.
Thank you for having me. So, as a pediatric integrative or holistic doctor, when I take care of patients, I see that when we spend a little bit more time talking with the families, assessing what the child's needs are, sensory-wise, pain-wise, how they may respond, it makes for a much better treatment plan because we take into account the needs of the child, right? And so therefore, it decreases the risk of labeling a child or a family as non-compliant. For example, if you order medications for a child and they will not take it, instead of saying, or the parents saying this child is a bad child, what we could do as pediatricians is say, advocate for the child if the parents aren't aware, and say, it may be just that his texture, he doesn't like the texture, right? And how about we switch it to a pill? And as parents, it's important to understand the preferences of your child, right? Because they're often routine and they have their preferences, and so it's sometimes they don't want to deviate from them, and that's fine. That's who they are, and it just makes for whole child care and whole family care when you incorporate all the needs of the child and provide access, because that should be the standard, right? Is providing access in that way to all that the child needs.
Great. Dr. Komolafe?
Sure. Thank you, Nicole. Would you repeat the question so I can make sure I come from a different angle?
Yeah. So in your career, what have you seen in areas either positively impacted when the providers do take into account the autism, or negatively impacted when providers are either not aware or not factoring in this neurotype specifically in their care?
Well, thank you, Nicole. And thank you, Dr. Eko. To echo what Dr. Eko said, a lot of times when providers put in the autism diagnosis into the care, and they're able to treat the patient as a whole. They're able to look at the behavioral aspect of autism. They're able to look at the psychological, emotional, social aspect of autism, including the physical health. And when needed, they can even bring in the experts like Dr. Eko into the mix to treat the patients. Not all pediatricians can treat autism. Not all primary care should or can treat autism. There are specialists who can treat this patients. Sorry. We should be inviting them into the mix. So a lot of times when a doctor puts that into consideration, they bring in experts, and the experts can really do their job. And to echo also what she said, when a patient is having behavioral issues, they don't always label it as a mental health issues. Rather, they understand that this is part of the autistic spectrum symptoms that they're exhibiting, and they can ask more for a trend in how the patient is behaving. Because a lot of times it's the patient who are nonverbal, who are behaving in ways that people might label as maybe aggressive to those who don't understand autism, but really it's the patient trying to communicate, saying they don't like this, or they want attention from their parents, or they want a hug, or they're trying to communicate. So when a provider really puts in the fact that they're not always the experts, or that they need to treat the patient as a whole, include, looking at their physical health, their social health, their mental health, their autism diagnosis, and bringing all the right people in, including their family, then the patient can really be treated as a whole. Because autism is a spectrum, right? And sometimes their symptoms changes over time. Just the Dr.
And that's
Eko.
really, where my experience came in. I work as a BCBA at an elementary school right now, and I have a lot of clients where, in the behavioral trends, I do see medical issues. And I had a student who I was able to associate 90% of his self injurious behaviors to bowel movements. And when his family brought him to the GI doctor, I was really shocked to hear them say from the beginning, well, this is a behavioral issue. This isn't medical. And they hadn't run a single test yet. And, my data showed, okay, I have a strong association. Almost every single instance of his self injurious behavior happens before, after a bowel movement. Mind you, the bowel movements were not regular even to begin with, other than having that association. And to hear the doctor say, that's common in autism. That's just behavioral. You might want to get him on some psych meds. And they were looking to sedate him rather than to find out what the behavior was actually telling us. And like you had mentioned, he was nonverbal. He was not able to articulate to us, like, I'm having pain, I'm having discomfort. And it took really about a year and a half working with the family and the doctors for him to get a diagnosis. And he turns out to had, a genetic disorder that was from birth, that essentially his organs were failing inside him. And it was a very rare genetic disorder. But I think back on how the doctors just said, no, this is behavioral. And when you have a family and you have these trusted medical professionals, they're going to go based off of what the specialist said. This was a GI specialist, and he said it was behavioral, and that's really difficult. And I see a lot of that, especially with my nonverbal like clients, but even clients who I have who might be students who are in general education or adults with autism that I see. It's really shocking how little it's taken to account. It seems to me more like a footnote at the bottom of a page. And in my coursework, I really looked into a lot of different disorders and medical experiences. And one of the things that I found so interesting was, I think it was the work I did in your class, when I was looking at autism and eating disorders. And anorexic patients spend significantly more time in inpatient treatment when they had autistic diagnoses, yet there's really almost no evidence based practices for people with autism as well. And, I was proposing a pathway, but one of the things I wanted to ask you guys is what you think the biggest barrier is right now. Because I feel like in the current climate, there's a general understanding that practitioners should have a better understanding of autism and different neurotypes that may impact their clients, but it's still a barrier that we don't see a lot of physicians either getting more education on or doing in their practice. And I wanted to kind of propose to you guys, what do you think that barrier is?
Okay, so I'm gonna say a little bit about what you said previously. You're spot on because as a holistic pediatrician, that's the way I approach children with autism. If you tell me a child is aggressive, my first question is, are they constipated? Not anything else, because there's research to show that when the gut is inflamed, it inflames the brain and you get this behavior. And especially with gut inflammation going on, you see a lot of self-injurious behaviors. That's how it would manifest. And so you are absolutely spot on that. As to why so many physicians don't relate it, I think back to when I was in medical school. I think we were just taught that autism was one of the childhood diseases that we have. And as pediatricians, really, we were honestly just trained to say, okay, yes, that's autism. You're not sleeping well, that's autism. You're not eating well, oh, yeah, that's part of it. And not really given the tools to do anything about it. And so that's where that's coming from. And I think that it's important as we're getting more and more research done and showing all the correlations that I mean me, I guess I need to talk more to my colleagues, but also yes, it's absolutely important that the biggest reason physicians respond the way they do is lack of training, because right, holistic medicine still is looked as oh yeah, that other thing, but really there's research that supports it, right? But I think that we continue to have conversations like this and just continue to put that information out there and inform the parents as well to ask questions, to advocate for their kids. I mean, I'm not trying to put it on the parents, but if we have better informed parents, then they can ask specifically for things, right? And they can even show the research if possible, so that the physicians can meet them somewhere in the middle, like there's a middle path going forward.
Thank you. Thank you, Dr. Echo. And to support what Dr. E just said, I started my career out working with individuals with autism. And one of the things we did back then, which I know is still being done, is we had to document everything that happened throughout the day. We needed a pattern, and the pattern showed us what was going on with the patient. So when they deviate, we could look at the pattern and be able to identify what's going on. So we usually would document what they had for breakfast, what time they woke up, what they had for breakfast, what they did between breakfast and lunch, what they had for lunch, what they did between lunch and dinner, what they had for dinner, what time they went to bed. And then we would typically ask them, did you sleep well? Did you wake up during the night? Sometimes we would even have like baby monitors in their room to help us. And all of this had to be written down. And when they go for their doctor's appointments, which is once every a month or once every 3 months, you have to take that journal that you've been taking, take it to the doctor, and the doctor would use that to review what's going on with the patients, including their meds, and talk directly to the patient, right? If the parent is there, the family member, you're there, you can answer question only after the patient has nodded. And in some cases, the patients were not even verbal enough or coherent or cohesive or cognitively able to respond. In that case, you still have to talk to the patient, but the a caregiver can respond on their behalf. So when it comes to being able to ensure that we're educating individuals, I think that's a model that we can easily follow. And I also know on a national level, we now have the Autism Cares Act that was released in 2024. That's meant to really bring funding, education, awareness into our institutions, into the medical field, into research, into training. And hopefully we'll continue to see that. I know this is something that will go on for years. So as an institution like Cummings Graduate Institute, having someone like Nicole walk and write papers about this, is bringing awareness. Dr. E, I know you're doing a lot in this field. But we all need to see how we can better engage with this act
And
on
I,
state
I
level.
engage with it a lot in my work because part of ABA funding now comes from the Autism Care Act. But I find it really, the word's not underutilized, but not utilized well. So now that, as a part of the Autism Care Act, these insurance companies need to provide insurance funded ABA supports, and they need to be medically necessary. And what's so interesting to me is it's medically necessary based on the diagnostic criteria of autism and not what's medically necessary for the person. And I would love in my work at CGI to really be able to change that a bit, because I think we're missing a great opportunity for us to collect that data that you mentioned and provide it to the doctors. Like I myself, I do consult with a lot of physicians. It's particularly like prescribing neurologists and developmental pediatricians throughout my work. But I know it's not always common practice. Like it's something our field really encourages. But if we were able to do things like more medical descents, I have clients all the time who parents tell me they need a sleep study, they need an EEG, but I can't bring them. They need an allergy testing, but they have to be restrained in order to do that. And so much of those like insurance-based ABA services are really focusing on like trivial things like reducing self-stimulatory behavior, which, as we know, can be really distressing if not provided with a functional replacement behavior to get that sensory and regulated input. And so, to me, as a clinician who knows about this stuff, that's not a priority to me. But for my clients who really can't get the medical treatment they need because they can't engage in the behaviors or the testing that's required for some of either these diagnoses or ongoing treatments, like that's valuable. And I think if we can, change the way insurance companies define what's medical necessary and change what they accept as assessments and appropriate goals, we can really put these funded services to much better use, which would be much more applicable for these doctors to then see. Unfortunately, sometimes I do see doctors really not take that stuff into account. I was able to, one of my clients, show that on nights that she didn't sleep, she engaged in 3 times as many behaviors within the classroom that particularly unsafe. And, the mom felt confident in the report I wrote for her neurologist, and the neurologist said, "Oh, unfortunately, that's autism." So I do find kind of both sides of the system where sometimes they're not taking into account their autism, but sometimes they're also over accounting for their autism, and they say, "Oh, that's normal. Lack of sleep, sleep disturbances, that's typical in autism. Self-injurious behavior, that's typical in autism." But they don't necessarily look at the client individually. Have you found that, Dr. E, as well, when you work with
Yes.
other practitioners?
Yes, and if I must confess, that's how I used to approach it until I had something going with my child, and then I got introduced to holistic medicine where I learned to look at the whole child. So yes, I mean, unfortunately, that is the way we are trained, right? Is to put everything under the umbrella of autism, even though research shows that if you can absolutely improve sleep, you can absolutely improve behavior if you address what's going on with the child, like looking at, are there any things that the child is eating? I mean, in my own practice, as little as changing the food, I had this 2 year old that was super aggressive, right? And mom was crying and scared of this child. I mean, to find a mother scared of a 2 year old is something. But I just made one change because he was very constipated, not sleeping all night, and just was uncontrollable. And he also drank a gallon of milk in 3 days. So I said, okay, let's decrease dairy because that, of course, worsens constipation, and increase water intake. In 2 weeks, the kid was not self-injured, like was no longer aggressive. So what changed? Well, mom actually listened because at first she thought I was crazy,
Yeah.
but then she listened, decreased the dairy, he started sleeping, less constipation, aggressive behavior resolved. So it is, I mean, like you said, there's training available, and it's just us working together to get this information in front of our colleagues. Hey, we can think a different way than the way we were trained. It is possible, especially when we need to look at people as a whole and not just here's their diagnosis, because children with autism, adults with autism are more than the diagnosis, right? They are human beings who need care.
Yeah. And I also think
So,
there's an extent to which, like, yes, the training needs to be there, but I think that's really where that DBH position kind of comes in because, doctors have these extensive caseloads and doctors have a lot of things to manage. And I do think to an extent it's almost unreasonable to everyone to be an expert, right? Like if you have, let's say, a GI specialist or you have someone who's a cardiac specialist, it's kind of hard for them to also be an autism specialist, right? Which is a whole another conversation because I think no matter how specialized you are in autism, they say if you know one person with autism, you know one person with autism. And I do think, there's no such thing as an autism specialist. You can be highly educated and trained, but an actual specialist, is there a thing? But I think it might be difficult and almost unreasonable to expect every level of doctor to be a specialist. But at the same time, there needs to be someone who is medically literate enough to, let's say, read through a treatment plan and do those things like you talked about, like speaking with the parents of their sensory needs. Like, are they able to follow through with that type of medication ingestion? Yes, they might be a teenager, but have they learned how to swallow a pill yet? How would you teach them to do that? Because that's another another thing I find is, it gets to a point where you have, this is the treatment plan, but how do you actually implement it? You could have the most evidence-based treatment plan that would be effective with that client, but if they don't have certain prerequisite skills, there kind of needs to be someone in that position to act as that mediator between the doctors and the families to be able to carry through with those treatment plans. And I do think to an extent, like, it might need to be someone outside of the doctor. I think the doctors need to be educated and comfortable enough with saying, this is out of my scope of practice. We need support, because I think that's another thing that's sometimes difficult with any professional to say. Like, this might be too much for me. I need to ask someone else. But I was wondering, with that sentiment, like, can you think of anything that would help doctors get to that point? Like, how can we make this easier for them to either learn and gain training, or like what adaptations or accommodations can, help doctors get to that point, or help families work with the medical professionals to be able to support that?
Yes, so I think it's a complex answer a little bit. There's the system as we have it, right? The insurance based system where doctors are put on a 15-minute time leash that we have to see patients in 15 minutes. I mean, by the time you say hello and hi, half the time is gone. So that's one big barrier there, is these doctors have enough time to even delve into any of that. And I agree with you. I mean, the point is not for everyone to become a specialist, not at all, but at least let's have the awareness to ask the questions, right? Okay, so let's ask about sleep for this child. And if the parent brings it up, who can we refer to? What can be, even just to know that there is something that can be done about it, right? I think that's the starting point, that we physicians know there is something that can be done to improve sleep. There is something that can be done to improve constipation, because it affects behavior, because sleep affects behavior. So if we even start with that awareness, that's a big battle won, right? And opens up access. And that's where partnerships with DBHs can come in, right? Because, okay, so here, this is someone we've partnered with that can help you walk through the issues that and concerns that your child may have, and provide further resources. Because yes, you're absolutely right, physicians cannot do all of it, but I think the awareness of that everything isn't autism is a big place to start. I think that would definitely help.
Yeah. And I know we've talked a lot about right now people who are already diagnosed, but right now, especially in the climate we're in, there's a lot of question of like the increase in diagnosis recently, but I even still think our current numbers don't really represent the population at large, right? I think it's still very underdiagnosed, particularly in women, and people who right now culturally it's finally starting to even out. I think the statistic was like 2023 was the first time we saw about even diagnosis rates among different cultures, but still people are getting diagnosed a lot later and then missing really big treatment opportunities. What do you think we need to do to help people more accurately get diagnosed? When we look at especially adults without a intellectual disability, when we look at the diagnoses for them, we see a lot of people getting other mental health diagnoses first, particularly borderline personality disorders, a lot of anxiety, and OCD disorders prior to getting an actual autism diagnosis. What do you think that barrier is, other than diagnostic criteria, in getting better diagnoses and faster diagnoses for people?
Yes. So I do pediatric evaluations, and often when I'm asking the parents questions, I see the light bulb go on with the parents. I'm like, oops, I do the same thing. I sound the same way. I act the same way. And then they're like, where can I get an
Yeah.
evaluation from? Or they get really upset because they're confronted with something that looks like them and is and that's what we're looking for the diagnosis of autism. And so I think there's that, and a lot of denial, especially with certain cultures, right? They don't, that's not something that's considered, or it's considered a bad thing. I mean, I've encountered parents where when I tell them the diagnosis for their child, now they say, well, we're going to lose our family and our friends. And this is in the US. And I'm like, oh, so how can we walk through that? And so it's just having those conversations with the parents, like, this is still your child. The diagnosis hasn't changed your child, right? It's just now we can put support around your child. And for the adults, I would say it's continued education and sharing knowledge, right? Because you're absolutely right. They may not necessarily look at this is possibly autism, and we're instead thinking mental health because they've masked for so long, or yeah, they've masked for so long, and now they're exhibiting behaviors and they can't mask anymore, right?
Yeah.
And so behaviors are out, and now it's like mental health, even though it may be autism. So I think it's just a lot of continued discussions in the mainstream about autism. You're more than a diagnosis, right? It doesn't define who you are, your capabilities. Like, an individual is, I mean, as long as you put resources and support around them early on, there's no telling who they will be and what they're capable of. And so it's just having that discussion continuously and letting people know it is, I mean, it is a brain type. That's what it is. It's not a bad thing.
Yeah.
And I think there's still a lot of bias and a lot of stigma that comes with the word or the diagnosis. And so
Yeah, and I
people may
think
not.
being a spectrum, everyone has such different experiences because you do have families.
Mhm.
Um, at the district I work at, I'm kind of the neurodiversity head. You know, every April when it comes around, they say, Nikki, let's talk about it. And I think, between movements like Light It Up Red or, I'm Light It Up Blue or red instead, and then gold, everyone has a different perspective because you have families who have children who are very, very severely impacted, and they say things like, no, it's not my child's superpower. Whereas then you have adults who might be fully integrated into the world who are somehow failing, within their jobs. They can't hold a job, but there's no support. So we do see like a significant more support for people who are one fit more of like the current research of diagnostic criteria and who are more impacted from their youth. But what I've been seeing is a really large trend of people getting diagnosed in their adulthood after having either some kind of significant adverse life event or not being able to make improvements in certain areas of their mental health. And one of the things I was proposing in some of my work recently is particularly autism screening and treatment resistant depression, because what I'm seeing a lot of is people who've had years of psychotherapy, years of different kind of medication management, but they're still not having the success that they're looking for and might be still struggling with a lot of suicidal ideations. And given the fact that, the research shows that people with autism and without an intellectual disability are 9 times more likely to die by suicide, I think that's a really staggering statistic that we need to look at and really figure out how to adapt these treatments for not just, okay, the symptoms are depression, the symptoms are anxiety, but what are you doing? Are you having a lot of masking fatigue? Do you not know how to manage your own sensory needs? But again, I think that's a big barrier in training for people to one, identify when their clients say certain trigger words that should make them think autism, but also in having therapies that are adapted for autism. Do you have any providers that you automatically think of when you need to refer out to something that might not be just pediatrics but might need additional supports? And what are those go-to providers for you? What do those providers look like, um, in terms of like, okay, I know that my client needs help, that might not be me, this is a provider that I know is informed enough? Because I think that's the issue, is I think people are starting to recognize the need, but I have clients who might be on a 6-month wait list for things that are urgent because these providers are few and far between.
Right. Yes, I make it a point of duty to create partnerships with ABA therapists, speech therapists, OT, adult psychiatrists, adult psychologists, because it always comes up all the time. And I consider myself an adult pediatrician, quote unquote, because I've realized that if I don't care for the parents as well, I can talk all day about the children, and I really won't go far because the parents also always, in my experience, they need
Yeah.
help, right? It may not be the same as the child, but they need help in something. So absolutely, yeah, it's important to recognize, okay, yeah, we need additional help, and this is who can do it, and even looking at ABA therapists that will see children at 22 or young adults at 25, because I absolutely think it would still help them at that age, right? If they need, if there are some things that they need help with, social skills
Yeah.
wise, and just try, yeah, you're absolutely right. There's not that many, but finding the ones that are is important, and just creating a referral list and encouraging parents not to be ashamed of seeking help, because I think I found that's the other thing is they may feel like um, not wanting to talk about the way like they should have it all together, and that's not always the
Yeah.
case, right? We're all human, we all need help. It's just encouraging them to say, here it is, making access easier for them.
Yeah.
Here's the name, here's the number, please call them and they'll help you. So
And Dr.
yeah, I think
Komolafe,
that's very important.
oh, yes, thank you. And Dr. Komolafe, this one's particularly for you because I know that you have um, a lot of work experience in being that kind of disruptor, being a big systems change person. You know, there's not a lot of supports for adults. You know, after they age out, and usually for that it's 22. There's really not a lot of supports, particularly that are funded. So you see very one limited supports, but also not always great quality supports because quality clinicians will not take such a reduced fee. What do you think might be a key into making change for the system so that we can get more of these supports, we can get more things funded for more people who are quality clinicians to do necessary services?
I feel in my personal experience engaging with group homes. So there are group homes that are very specific to individuals with autism who are on the spectrum. Engaging and funding more of those group homes will ensure that we're able to meet the individuals where they are. And for individuals whose parents want them to stay at home, there are day centers where they can go to. And a lot of times, the day centers and the group home will take on their medical follow up and their medical coordination. And by doing that, these individuals and their parents get the supports they need once they age out of the system and as adults.
Yeah.
From my personal experience, those have been the best way to ensure once the individuals age out of the system, they continue to get the help. So you can either stay at home, but go to a group home, even if it's once a week, because the group homes continuously see different individuals who are on the spectrum, and they typically have
Yeah.
experts who know how to coordinate care for these individuals.
And what about for the population who might be just independent living but impacted? Because that's one thing I see a lot is I have a lot of clients who, you know, in New York State, we have OPWDD, which is the Office of People with Developmental Disabilities that fund a lot of these services. But I do have a lot of clients who are gen ed students who will, you know, go to college, who don't qualify because their disability isn't impactful enough. But it might not impact them until they're living on their own in the world. You know, they graduate college, they're 22, and now they're had their whole life that someone was there supporting them along the way. They might have had an IEP or a 504 at school and additional supports. And even though businesses say that they accommodate for disability, when they get into the real world, they might really not have a lot of supports and only see them having significant difficulty in adulthood, but don't qualify based on insurance's definition of what the impact of their disability is. What do you think we need to do for that population?
Yes, the DSM-5 now accounts for autism being on the spectrum. So engage with your psychologist and your psychiatrist to have a specific diagnosis that can support you that you can take to work. So that's one way to look at it. And with the Autism Cares Act, health plans are now being held accountable, right? It's going to be a progressive shift that we'll end up seeing, but we're gradually seeing this accountability and these movements towards providing support for these individuals. And if you don't have the support, if you don't have a chair, if you don't have a table, bring your own, right? Create your own movements to educate your providers, your employers, your family, and people will follow. You know, it was a great thing for Bill Gates to come out and tell us he's on the spectrum, right? I think that opened a lot of eyes. I have a nephew who is on the spectrum, and for us as a family, that allowed us to really support his passion. I mean, he is right from when he was 7, he could do anything computer without being taught. So we had to go research how we could support him. We didn't have, and he lived in Nigeria. We didn't have that. So we had to research what type of foods we could give him. And just changing his diet helped. We had to bring our own chair and table. We had to create an environment that supported his expertise. And we ended up realizing watching 5 hours of a math video, which was boring to the whole family, was, was a way we could support what he was trying to build in his own mind. So I for individuals who don't have that support, you know, consult with the nearest healthcare professional, like a neurologist, a psychiatrist, a psychologist, when available, and then do your own research, gather it together, go talk to your employer and your HR and see how they can support you.
And I think, for myself, being in this program at CGI, I've kind of been doing exactly what you said. I'm bringing my own chair to the table. So I myself have autism. I was diagnosed at 30, and my entire life changed once I started to account for the autism and everything I struggled with. And that's really why I'm so passionate about this research, is because it was such a simple change, even for myself. Like you said, even just the people around me and my own understanding of myself and my needs made such a drastic difference in my physical and my mental health. And, I'm so now driven to make that change for everyone else. And it seems so simple in so many areas, but I know really we need to make big systemic change to help um, these providers in their training and their acknowledgement, and the families even knowing what's available to them. Because that's a big thing too. I think sometimes people don't have the direction and where to approach it and how. And I can tell you as an adult, getting a diagnosis is expensive. But I'm really hopeful in, the more research coming out and causing a lot of conversations in places, because I don't think people realize how much of a financial burden it could be on the system sometimes, because the emergency utilization, rather than proactive interventions, is very costly on our system. So I'm hoping with a lot of this current research that's coming out, and the advocacy from families, and even just social media actually plays a big tool, I think, in a lot of people getting their own diagnosis and speaking to their providers based on what their needs are. I'm really hoping to be the change and see the change that we're all looking for here. But I wanted to thank you both so much for being here, and being a part of the conversation. Like I said, even just the exposure and people seeing these conversations sparks a lot of ideas and change. With that being said, I wanted, like I said, thank you guys so much for coming, and I hope to further this conversation, and keep in contact. I'm lucky enough to have Dr. Komolafe as a teacher, but Dr. Eko, I would love to continue conversations with you, because I'm really inspired by you actually being that change, because I don't unfortunately get to encounter a lot of physicians, and particularly pediatricians, who are on the same wavelength as you. So one, I'm very grateful for the conversation, but two, would love to continue it as well. But on that note, thank you both so much for coming, and that's a podcast.
If you enjoyed this episode, don't forget to subscribe and share. Let's keep disrupting healthcare together. Until next time.